Babulal, thank you for that presentation. I think the tremendous experience both here and in other countries, I think, will help in developing some of the thought about healthcare delivery in India. We'll take some questions after Erik has spoken as well. So quickly, I wanted to introduce Erik. Erik is with Pfizer and was responsible for a joint venture or a partnership between Pfizer and GAVI relating to a particular vaccine being brought to the world, and in particular the poorest countries in the world, to combat infant disease. I described him earlier as a world citizen. I'm right in saying French, has spent a lot of time in many, many different areas of the world, as has Babulal, US, Asia, Europe, Latin America, Africa, Middle East, and has done so in a previous guise as the country manager of the Czech Republic. During this period, he's also served on various institutions and associations, such as the Czech Pharmaceutical Industry Association. I think brings great experience to actually a very granular and purposeful process of taking vaccines out to the wider world and seeing whether we can address some of the issues that Babulal was saying about healthcare being a driver for economic not recovery, but growth in a particular nation. So, Erik, over to you. And as I say, please start thinking about questions, and the guys will be ready to go.
Thank you, Mr. Moderator. So, ladies and gentlemen, affordability is always a key question in emerging markets, and India is in the same bag, if I should say. So, what I would like to do today is to share with you a very special initiative, which was triggered by Bill Gates a few years ago, which allows newborns in the poorest countries of the world to have access to the newest and most expensive vaccines of the world. And Pfizer, of course, is involved in this as a partner in the initiative, because we do believe that all children should have access to vaccines, whether or not their parents can afford these vaccines. So it all started in 2000, when Bill Gates decided that it was time to address what is called the vaccines paradox. And I'm going to explain this paradox. When there is a new vaccine, a very effective vaccine, it's immediately used in the developed world, very quickly. It's rolled out within a few months. However, in the developed world, these vaccines used to reach the developing world 10 years, 15 years after they were made available. And usually, the burden of disease is mostly in the developing world and not so much in the developed world. So that's the paradox, okay? So Bill Gates wanted to address this paradox, and he initiated an initiative which created GAVI, which stands for Global Alliance for Vaccination and Immunization, which is an international organization based in Geneva, and which has brought together partners from the private world, from the public world, together with this goal to reduce the vaccines paradox. So GAVI supports today 73 countries in the world. These countries are mostly in Africa and Asia. However, there are a few countries in Latin America, a few countries in Europe. And what GAVI does, of course, GAVI helps to roll out some vaccination programs. Some of them are mentioned on this slide. But what GAVI does also, GAVI supports also the strengthening of the healthcare systems in these countries. So I'm going to describe to you a more specific initiative around the pneumococcal vaccines, which is the part where Pfizer plays a bigger role with GAVI. And pneumonia is number one killer in the world, and particularly for newborns and babies of less than 1 year old. So what what GAVI decided to do in 2010, not such a long time ago, is to launch a pilot program in order to accelerate also the adoption of the pneumococcal vaccines in the developing world, in the GAVI-eligible countries. So what GAVI did, GAVI put together all these partners, and I'm going to describe the partners because they come from very different worlds. The first one is clearly the Bill and Melinda Gates Foundation, which is the driver here to put together the partnership, but also to fund the GAVI Alliance. A lot of money comes from the Gates Foundation, and the Gates Foundation have put more than $5 million thus far into the GAVI Alliance. You have the World Health Organization, WHO, which helps to make sure that the vaccines which are, I would say, elected are the right vaccines. You have the World Bank, which helps to the financial part of setting the alliance, and you have UNICEF, which is clearly buying the vaccines for the GAVI Alliance and making sure that the programs are implemented in the countries. Then, as part of the alliance, also you find the donor countries. And here, in the case of this pneumococcal vaccines initiative, you have 5 donor countries: UK, Russia, Italy, Canada, and Norway. And you have the GAVI countries, which are co-financing. So each GAVI country, it's not free, participate in the funding of the program. And you have the pharmaceutical industry. So all these players are sitting in, and there is a governance for that, are sitting in the same board and are making the decision on behalf of the GAVI Alliance. So the way the GAVI countries are selected, it's really based on the gross national income. And to be GAVI eligible, you need to have a GNI below $1,580. And the countries, there are tiers in this GAVI organization. The low-income countries only pay 20 cents per dose of the vaccines. Those who are intermediate pay a little bit more. And those who are graduating, which means that they exit GAVI, but during 5 years, they still receive support from GAVI in order to be able to finance these vaccines programs. So the role of Pfizer into this, okay? As a company, we have committed to supply up to 740 million doses of our PCV pneumococcal vaccines through 2025. It's a one-way commitment. That means that Pfizer must supply if needed. However, GAVI does not have to buy from Pfizer because it all depends on the needs. And the second element, which is also very important, is that the price to GAVI has been reduced by more than 90% for these specific vaccines, which in a way was the whole spirit of this in order to tackle the affordability question. So we, in 4 years, we have been able to supply 37 countries with 130 million doses, and that covers close to 20 million babies. And we have also committed to invest in a manufacturing plant that will produce a specific formulation for GAVI, which will be a multi-dose formulations, because these countries don't have so much space to stock the different vaccines. And of course, the more important into this is clearly the impact it has on the society. And this GAVI initiative, specifically for the pneumococcal vaccines, will be able by the end of 2015 to save more than 500,000 lives, and by 2020, 1 million lives. And we've been able also to demonstrate in one of the first countries where pneumococcal vaccines were made available in 2010 that the infant mortality was reduced by 33%, for instance, in Nicaragua. So here, what does it mean for India? And for India, India is a GAVI country, first of all. And India has been using GAVI for a few programs, not too many. India has not yet taken full advantage of the GAVI process, but is moving rapidly towards this. Particularly in the past 3 years, GAVI has supported the pentavalent vaccination in India. And now India is also moving towards inactivated polio vaccines that will be supported by GAVI, and there will be more vaccines that will come where GAVI will play a role in India. However, India has been a little bit behind, but we have felt I would say in the past 18 months, a strong movement towards more participation in these global initiatives. So I thank you for your attention.